Hi, I'm Dr. Baloo, and today I'm going to be talking to you about tooth decay. Tooth decay is when your tooth starts to break down. Sometimes you'll notice that you have a hole in your tooth, or you might just start to see some white spots or feel some sensitivity. So tooth decay is caused by acid that is formed by the bacteria in our mouth. A lot of times the bacteria is eating on the sugars from our everyday diet, be it like candy, eating carbohydrates. They break that down into acid, and that starts to break your tooth down. The signs of tooth decay would be white chalky spots on your teeth, a hole in your tooth, or you may even start to have sensitivity, be it cold or sensitivity to sweets. And there are some people who don't even feel anything at all. The effects of tooth decay can be, again, having holes in your teeth, not being able to eat your food properly because you're avoiding trying to hit the area that's been affected, and tooth loss. Tooth decay can lead to other complications, the main one being tooth loss, needing a root canal, or potentially infection if the decay gets so large that it gets to the nerve of your tooth. Tooth decay, once it's gotten to a certain size, cannot return to normal. We call other lesions what we call incipient lesions, meaning they're the beginning of a cavity. It's just been located within the enamel of your tooth. At that point, we do try to use things like fluoride or hydroxyapatite to remineralize that structure so it does not progress to the point where we need to do some type of filling or other type of restoration on that tooth. The point that tooth decay is irreversible is when it breaks through that enamel layer into the dentin, and at that point, we need to do something about it. So some treatments for tooth decay, if it's an incipient lesion, meaning it's the beginning of a cavity, we try to use fluoride or hydroxyapatite, changing habits and flossing to stop it from progressing. If the cavity has progressed to the point where it needs a filling, we go in and remove that soft part of the tooth until we get back to a healthy portion of that tooth and fill it with a tooth colored filling, also known as composite. So the best way to stop tooth decay from spreading is, one, treat the cavity. And then two, we want to make sure that we're changing the habits that got us to that cavity. So increasing your flossing, watching your sugar intake, making sure that you are definitely brushing before bed and when you get up in the morning as well. You want to see your dentist about tooth decay as soon as possible. The best way is just to catch it before we even need to do a filling. But if it's already progressed to that point, we want to take care of it sooner rather than later, because the longer we let it go on, the bigger the cavity gets and the more tooth structure we have to remove in order to stop that decay.